Everything. Why?
No, but I say a money public. I say a money public. I think you maybe I say. So catch me say, oh you're concerned about video and that public can go viral. But when you're concerned about Nipadana own yeah, what
did they attend to the person? Did they do the necessary treatment? A civilian came to do that.
Any health facility in this country, it does not warrant any physical attack or assault on any health professionals.
Abusuya sabi the Raf, the fellow Ghanaians, sabi the or trendy ewo baby ah, say Raf any they call it this to me. Reach hospital now kwesi they around 10 p.m. thereabout for treatment. Those who say a nurse for an hour no and treating the year and I say one fan and 5 to seek for medical care and you know there was some confusion with the medical staff and the Reach Hospital at that time. The Minister for Health, Honorable Kwabena Mintah Kando, Wakasa, Afanomana, Raf, and the call for the hospital. And what you know, the president of the Ghana Registered Nurses and Midwife Association, Wakasa, issue 48-hour ultimatum say, Raf, and the call for now, Wakwa attack the medical staff of Reach Hospital, Nana Kuchidana, you know, they should be arrested and brought to justice. And yes, sir, Obeti, it is so called Achrabai. You bet you Monoati, it's as seminar, say, nay, or far by any baby, Abidu. Oh, make sure some subscribe here, kindly subscribe to Umsika TV, not follow on Facebook, TikTok, and Instagram. Here at Umsika TV for latest updates. Debusia Nana Kwesi, they are around 10 p.m. thereabout, and a rough. The fellow Ghanaians, you know, say Raf there, or can agony in all instances. And when the Koba say Raf, Chidemu say, Ubi the motor accident. And when now the Nipano Echo Reach Hospital for treatment. And on a Raf, no, Ubi the motor be body dim, a man and sa, Benkumi, a try, and Fiso, just so prime Abuja, a pramano. And until saw the hospital for immediate treatment. Now, Chelsea Oko PM Hospital work together with Nipana. When your motor accident, we collapse here, oh here emergency care no. I said there, unless a photo home crime or Chelsea or no Raf no. And so activated the card B and send will proceed with treatment. Our Chelsea emergency about moja a song good film, say and quasem on must say. Ghana they want to know and so go through the normal procedure before he gets emergency treatment. I'm not just say no. Or uniform or move from word to word. Every video near that they are another confrontation between the nurses and the staff on duty and Raf. And then call for our Stormy Hospital one never they see any day as so need and so catch it.
Please. Oh, let's go.
Who said you have a job tomorrow?
No. Let's respect him. Let's respect him.
Even if it's dress fine.
If you can, you're the only person I can allow to read this. So if you can dress it,
that's why I've come. I was coming to dress. I was coming to switch it for you myself. So if you can wait, we'll be ready. So if like you can wait when I'm ready, I'll come for you.
Right.
Okay.
That's fine.
Everything. Why?
No, but I say a money public. I say a money public. I think you maybe I say. So catch me say, oh you're concerned about video and that public can go viral. But when you're concerned about Nipadana own yeah, what
did they attend to the person? Did they do the necessary treatment? A civilian came to do that. You are yet all rich. Nurses don't know how to talk nonsense.
Charlie, I've been bleeding for like 3 hours now. 3 hours.
Stick it with a dirty needle. Don't play with it. I'm telling you. What do you think happened to Easy E?
Where did you park? Where did you park? Eric, where?
Civilian that came in to attend to a man somebody who was close to death. This lady that came to assist, not a nurse, reach hospital. A civilian who came to perform the necessary treatment, which there are nurses around. They are talking about degree. Degree. They are not serious. Madam, thank you very much. Okay.
Take a picture. Don't put in complaint.
Okay. Thank you very much.
Yes, yeah. We love degree more than we want to. Degree no one see the panel.
Everyone for. Say degree, degree. Who you see?
No, I see degree. I
see.
When the degree degree is a motor, scrambler,
yeah. So
okay, so I'm the caution.
Okay, so I'm caution Paul until I'm moving on course. So right now, Rage Force a problem with me doing a video to call the attention of the public that there is a patient that has been neglected at the hospital. Myself, I have been bleeding for past 3 hours ever since we came here, that after stabilizing the blood, getting the blood stopped, nobody was attending to me. Only for one of the patients in there start, palpitating. Medical term. And now they are much concerned about their video being in public, and that this is the kind of system we are living within. So when you rise up and you are speaking against certain things, that they are much concerned about video that public, but they are not concerned about the life of the person that is still in the ambulance sitting here and nobody is moving it. It takes the video we did for nurses and doctors to rush in here to prepare a transfer for the patient, because they say they can attend to him now. And for the past 20-30 minutes, that person is still lying down in that ambulance. Nothing has been done. That is him lying down there. There's the kind of country we're living in. So the system is failing everybody. So if you are watching this video and you are insulting, relax. The system will fail all of us. Me, my own, maybe I am okay. By your own, it will take just 5 minutes that somebody's neglect and somebody's negligence, ignorance will take your life. Let's wait. Let's keep quiet as if nothing is happening. Boss, you be the ambulance driver. What is happening? What's going on? Hey, Asemo Ghana. Inti yambe kasan fa kwa we hu ana oda ho no musa. Me na me plan ma ba hospital no. Me ndwene me de ho. Obi da ho no ma owu. Nurse for say obi a suro so obekọ no ho dia. Doctor to me bie na no say, "Wo hwe na say obi mu ye dede wa na mu ntumi na mu suro a mu mpie nje omo nko." Na patient ni ngugu no mu. Yeah. But at the end of the month, ya the same people we asika ebetua neka. Whether so chia tax direct or indirect or chia tax is more minor. Whether so chia on tio or your mine ba ne hu betunya manfaso am o minor. It is so yare ba ha. See a channel. Hospital way, ya the way sika ka hu ne di see here. My ben ye titiri. My ben ye titiri. Nurse ni abe ka ten say our problem with video na me ye no. Na mu ni abegu ya no. Dan nipa ne nkwa no. Obeda ka you man can go 30 minutes. There be catch a video no more saying or better can you see I'm 30 minutes. The combo boo, the naya boo, or Fimoja or the Honda. Yet now, mine, you better him na elbow boba.
Now, when you're in a rough, I could be a different hospital for treatment or buy no nice or some video be an answer of banning fire, which are no extra. And what I say, Ebanisena, you're the taxpayers' money to as nurses and medical staff. na Ghana ni epra ohia emergency care mo kire say eso koye no ma bia osusu say ebetimi aye ekire eba ne saa na say dey nipa nkwa edi agro sabi enu tebusia Ralph one ne crop for dey the way ho no no. It took the intervention of the Ghana Police Service to restore order at the Rate Hospital. And yes, sir, can ever be Yamin Kuana enim. And I'm so crampoma, Sabri America say, nurse in the Bakua, all hospital with pra I move a dimpa, Sabri the other hospital, or G medical care. Now, I know I'm so much Sabri the Honorable Minister for Health, Honorable Kabinamita Kando, Eku PMO Hospital, or the same be Atuba.
I had to send the first group to come and find out what really happened. So the report or the feedback I had indicated that I should follow up, that the health professionals were down-spirited and they were considering other options. And so quickly I had to come and engage them and to also have first-hand information about what really took place. And after that, I've had some behind the scenes or closed doors meetings with them. I've listened to their side of the story. I have not had the opportunity to also listen to the gentleman who made the social media live interviews or broadcast. I've just engaged him, but we've not spoken about the issue at stake. I'm yet to listen to his side of the story. But what is very important is that irrespective of the level of provocation at any health facility in this country, it does not warrant any physical attack or assault on any health professionals. I do not think that our health professionals deserve this kind of treatment. It does not necessarily mean that the allegation of delay in attending to them is true or false. But as I've stated already, no matter what, there shouldn't be that physical assault or attack on our health professionals. That should not be tolerated. And let me also make the point that we will investigate the alleged delay in the healthcare or in the treatment of those who were involved in the accident. And this has also brought to fore about the security of the health personnel, especially at Rich Hospital. And I have instructed that must continue, and we must put measures in place to prevent the reoccurrence of this particular incident. The law must take its own course. So I think that the issue must be investigated and the law must take its own course. That's what I can say about it.
And we're chilling a Ghana Registered Nurses and Midwife Association President Enra ko hospital wo eko hwe said ya nyoma no su eko efai. And we're chilling on the central for to train commodity send to go say 48-hour ultimatum. This is not the first time such attacks has been meted out on medical staffs. And you know what she said within 48 hours, you know, Ralph and call for now. Echo this Juma Nam so much be next in be a prano. They should be brought to justice. Senebeya, the payments at the FCM say, what mean few people hospital to attack staff because of you think they're not doing things right.
I think this is an unfortunate thing, as we have reiterated. I mean, it's something that keeps coming up, and we will do everything possible in our capacity as a union to stop this, all right? So we've met management. They've told us the measures that they've laid bare to, you know, if you like, mitigate whatever happened. But we are going to meet the nurses and midwives, and from there, we will take such appropriate action. As we speak, we don't know whether there's any evidence of arrest. You understand? And if you heard the lady right, she said that the gentleman threatened that they will follow them up and take one life. Okay, I mean, that's clearly something that is unacceptable, and we cannot countenance that. And if we meet our nurses and they tell us that they are not safe to offer such essential service at the emergency area, then we will do the needful. Don't worry, when we meet them, and
which is when you are not safe at your workplace.
When you are not safe at your workplace, I mean, the law is very clear. I mean, if you read the Labour Act, Section 119, subsection 1 of the Labour Law, okay, it's very clear that if you, in your own opinion, if you think that there is imminent danger at your life, okay, or at your health, you have every right under the law to absolve yourself from danger or to remove yourself from danger. And after talking to the nurses and getting to know whatever has gone on, we will take such remedial actions to guarantee their safety.
Okay. Fast forward, you bet you say, you're president is somebody to go, GNRMA, president to go, or said, this is the first time you are sorting nurses, and until that thing must stop. Until TN some of to go to say, near Abripa, and your Asim Kuma. Now, no, it's a rough. As I saw a video, I bet today the AT also the one so no. What this Juana Sawayas are the hospital. Jamusia, Sabi there, in summer, a Tregu, and you say, rough. The fellow Ghanaians who pride because when you accident say what they call rate for medical care. Now they could see one day at the same baby Naba. We are following this story. Say Sabria nurses president issue statement say they are giving 48 hours no. Yes, they are buying a bay afa. Whether because RAF is clearly identified say Okahubi. I don't see yes say information among na be am rather no what they are so na pere any as to me about the healthcare front according to the president's demand. So what the man first answer me do think RAF they are no they deserve that action and because now we pray also say they were delaying we should have firma was easy breathing they said oh here made immediate and as emergency care but necessary no they seem not to be caring at the time. So what do you in the comment section? Unsubscribe and so kindly subscribe to Sika TV or YouTube, follow on Facebook, TikTok, and Instagram for latest updates. Also, you first answer your mommy in the comment section.